Hello, good evening. This is Dr. Benny from Venro Healthcare. Welcome once again to our Health Bites. Today we are going to talk about cholesterol. So let's begin by first of all talking about what cholesterol is. Cholesterol is a substance that's very similar to fat found within all our body cells, and it's something that our liver can also make. We mostly get cholesterol from the food we consume, but like I've mentioned, some of our cholesterol is actually made by the liver. This is because cholesterol is a useful substance for the body needs it, so the body is able to make it. However, in some instances, when we have higher than usual levels of cholesterol, we can actually end up in trouble, and we'll talk a little bit about that. So why should you be concerned about cholesterol? First of all, cholesterol, if in very high levels in your blood, can actually increase your risk of getting heart disease. And you're probably going to ask, how does cholesterol increase one's risk of heart disease? One way it does this is by actually going inside our blood vessels, especially the arteries that take blood away from the heart to the rest of our body. It can go inside the walls of those arteries, and once it forms plugs in there, it reduces the space or the volume that's available for those arteries to carry blood. And subsequently, what happens is you can end up with high blood pressure because the space or the volume that your arteries use to carry blood has reduced. The other way cholesterol can be dangerous is when it is in our blood vessels. It forms what we call plaques, which when those plaques are formed, they actually, in some instances, do block blood flow to certain parts of the body, such as the heart, and in some instances, the brain. So some of the smaller blood vessels, when cholesterol is deposited within those blood vessels, you can actually have complete blockage of blood flow to those areas. And as a result, you end up with what people commonly call heart attacks and other serious conditions such as stroke. Yeah, so like we mentioned, your body actually does need cholesterol. So it's not an entirely bad chemical to have or bad compound to have within our bodies or our blood cells. But maybe you're going to ask, how high is too high? And generally speaking, cholesterol levels that are above 200 milligrams per deciliter are considered to be higher than one should have. But of course, these levels do differ depending on age, depending on one's sex. But generally speaking, levels above 200 milligrams per deciliter are considered to be high and require an intervention to be reduced. How do we even find out these levels? There are tests that can be done. It's a blood test. And once this test is done, your doctor is able to know how much cholesterol you have and will be able to advise you on the best way forward in terms of interventions, or well, in terms of, go ahead with what you've been doing in case your cholesterol levels are normal for your sex and for your age. There are actually differences there are different types of cholesterol, and still the blood tests are able to tell these different types apart. There are two main types. The first one is what we call the high density lipoprotein. This is what is also called the good cholesterol, and it's good because it actually leads to the bad cholesterol, which is called the low density lipoprotein. It does enable that low density lipoprotein to get out of the blood vessels. Remember, we said one of the dangerous consequences of cholesterol is having it deposited within the blood vessels. This high density lipoprotein, which is the good cholesterol, does enable this low density lipoprotein to get out of the cells. So it is the good cholesterol, and you want to have more of that and less of the low density lipoprotein, which, as we have already mentioned, is the type that is likely to stay within your blood vessels and cause all the various health issues that we've already talked about. So, what increases the likelihood of you having high cholesterol, especially the dangerous low density lipoprotein? The likelihood of having high cholesterol levels does increase with age. It also does increase with weight. So being overweight or being obese increases the likelihood of you having dangerously high cholesterol levels. In addition to that, certain foods, when eaten often, do increase your chance of having high cholesterol. For example, foods such as the skin of the chicken, milk, the yolk of an egg do increase cholesterol. And like we mentioned, as you age, especially we women, there is a likelihood for cholesterol to actually go higher, especially after menopause. The other risk factor for high cholesterol is actually familial. There are some families that generally have what we call dyslipidemias or abnormal lipid profiles, including high cholesterol. So in such families, you might find very young individuals who might actually not have the other risk factors. They might be have normal weight, but they will end up with high cholesterol levels because this is familial or genetically transmitted. Okay, so what happens if you have high cholesterol? We've already mentioned what risk factors, what medical conditions this exposes you to. So once you discover that you have high cholesterol, you actually have to work hard to make sure that you change that and revert back to normal cholesterol levels. So what can you do? First, it's important to exercise. Exercising on a regular basis does lower cholesterol. It's also important to watch what you eat. Like we mentioned, certain foods contain higher cholesterol levels than others. Egg yolk, if your cholesterol is high, foods such as the egg yolk, milk need to be probably almost eliminated from your diet. The other foods that are culprits are the saturated fats such as margarine, which we have to watch out for and reduce as we grow. Other foods such as animal fats like ghee, also we need to also make sure we consume less of those animal fats, especially if we have high cholesterol levels. If you smoke and you also have high cholesterol levels, it's important to quit smoking because smoking also increases the risk of having high cholesterol because it changes the way your body generally uses fat. The last thing is, of course, to consume as much high fiber food as possible and also to consume lots of fruits and vegetables. So beyond the diet modifications that we've spoken about and beyond some of our lifestyle changes like exercise, which we recommended, there are some drugs or medicines that can be prescribed to reduce cholesterol levels. There are drugs that we call, especially the statins, which can be prescribed by your doctor to reduce your levels of cholesterol. In many cases, the drugs are still used in tandem or together with the lifestyle and diet modifications that we've spoken about. It's not very effective if you take these medicines but continue to consume foods that contain a lot of cholesterol or continue to shun other healthy lifestyles such as exercise. So these go hand in hand, and your doctor will be able to advise if, in addition to the lifestyle changes and to the diet modifications, you also need medicines to lower your levels of cholesterol. So in case you want to find out more about this, please do contact us at Venro Healthcare, and we will be able to check your cholesterol levels. We have a team of people that can actually come to your home or to your workplace, collect a sample, and the results, in addition to the advice, as a result of those results, will be communicated or sent back to you as soon as the results are ready. In case you want to hear more about other health topics, please do check us out. Check out our YouTube page by simply searching for Venro Healthcare, and do remember to subscribe so that you get notifications each and every time we upload such useful content. Thank you for listening.